Hello, my name is Christine DiCarlo, and I'm the American Association of Colleges of Osteopathic Medicine's, or AACOM's, Media and Public Affairs Manager. I'm joined today by Dr. Kayse Shrum, who was selected to serve as the 19th president of Oklahoma State University, OSU, this past April. Dr. Shrum's history-making appointment, which was the result of an extensive national search, makes her the first woman to lead a public research institution in the state of Oklahoma. Prior to this role, Dr. Shrum served as the youngest and first female president and dean of a medical school in the state of Oklahoma, the OSU Center for Health Sciences College of Osteopathic Medicine. As AACOM celebrates Women in Medicine Month this September, we recognize that Dr. Shrum's significant achievements and groundbreaking leadership serve as a powerful and inspiring example to women across the osteopathic profession and beyond. Dr. Shrum, thank you so much for joining me today to discuss your considerable accomplishments as a leader, your advice and words of wisdom to others, especially women who are interested in leadership, and your thoughts about the importance of supporting, recruiting, and retaining women in medicine.
Thank you. It's great to be here with you today.
Thank you so much. So my first question is, you began serving as president of Oklahoma State University on July 1, 2021. And with this appointment, you became the first woman to lead a public research institution in the state. I'm just wondering how the COVID-19 pandemic affected your first few months in this role and the transition to a new school year.
Yeah, so it absolutely has affected the transition. Very shortly, within the first month of my appointment and my tenure here, we saw a spike in the Delta variant. And cases going up, and of course, classes on campus and students on campus after, last year, they spent the majority of the time in an online learning environment. And so students were really excited to be back on campus and try to get back to somewhat of a normal state. And as I have visited with, students across campus, many of us felt like, over the summer, we were done with masks, and we were, there's a lot of fatigue that people have experienced with the pandemic, and everyone was over that. So as we start to see those cases spike and really having to, address those issues again, I think that has made it challenging for everyone. My background, I think, has made it somewhat, easier for me to understand what's going on and to feel confident in the decisions that we were making. And, we have managed to get through, I think, the uptick. We're starting to see our cases decline now here on campus. And so I think that, we have managed to probably get through the most difficult part, really trying to find that, right balance of protecting everyone and then allowing as much of a normal experience for our students as we possibly can. And I feel like everyone has settled into that, but it certainly probably did change, the beginning of my tenure, I would say. So.
Right. I'm sure that's a big transition at any point, but with the pandemic on top of it, it's just a whole nother added, set of logistics to deal with. So
yes, it is.
Well, prior to your role as OSU president, you served as dean and then president of the OSU Center for Health Sciences, and in so doing, becoming the youngest and first female president and dean of an Oklahoma medical school. Under your tenure, the school experienced unprecedented growth, and your leadership helped double student enrollment. What advice would you share with other medical school leaders to help them achieve similar success?
I would say, I feel like, one, I had a great group of people. Nobody accomplishes big things without a strong team that supports you and is around you. So first and foremost, I would say surround yourself with great people. The other piece I would say is, be true to your mission. I think we found a lot of success because, our mission was to train primary care physicians for rural and underserved Oklahoma. And that was really the lens that we looked at in every, aspect of the College of Osteopathic Medicine, whether, we're a part of a land grant university. So whether that was through our research, through our education, or through our service. We were trying to see how every decision we made, did it fit with our mission? And we I think found a lot of success there, because that mission is unique to our medical school in the state of Oklahoma. And that helped us as we were looking at a partnership with the Cherokee Nation and having the first tribally affiliated medical school in the United States. That is the Cherokee Nation and all of our tribal nations were in rural areas. And so that fit very nicely with what we were trying to do to train physicians for rural areas. And we realized very early on from a strategic standpoint that we could not truly fulfill our mission unless we had a very close partnership with the tribes. And so that's an example of what I mean by, really focusing on your mission. Another big accomplishment was the, creation of the National Center for Wellness and Recovery, and the $197 million that came to us to support that from the opioid settlement with the state of Oklahoma. That really, it didn't start because of that settlement. It's the National Center really started because we recognized that an underserved group of patients were those, struggling with addiction. And, for a public service, we really needed to begin creating a treatment clinic, but also doing research in that area. And so, that wasn't a very, when we started in that space, it wasn't a real, popular space to be in. It's not a money maker, so that's where I say, if you're staying true to your mission and you're doing things because they're right, and you're fulfilling, that service or that, I always feel like as a medical school, we have an obligation to society. And so paying attention to what is going on and what are the greatest needs, helps really make your medical school relevant, not just to the students that are there, but to the state, to the nation. And the third I would say is, as you're making decisions, keep the student's best interest at heart. And, as we would think about expanding, my philosophy was always, we're going to expand residency programs first, because I want to make sure that all the students we're bringing in can stay in the state of Oklahoma if they want to. So that's an example of, those are the three things that I would say are the most important or were key to my success, is having a great team, being true to our mission, and being, student-centered in everything that we do.
Thank you. I really appreciate those points. And I know the AACOM audience, we have a lot of COM faculty, obviously COM administrators. So I think that would be very helpful for them. And it's certainly inspiring to think about, if you have a lot of need in your community, which a lot of communities do have a lot of need, and keeping that at the forefront, I think is really inspiring and important. So thank you for highlighting those. So my next question, the COVID-19 pandemic is unfortunately causing an unprecedented number of women to leave the healthcare workforce. In your view, why is it important to support, recruit, and retain women in medicine?
Yeah, well, I think that having a diverse, workforce in any industry is important. We know a lot about, human nature, and especially in medicine, it's important for your patients to, many times be able to relate to their physician. And, that's a big part of it's a big patient population. And so, having women in medicine is important from a patient care perspective, but I also think from a perspective of medicine in general and decision-making, and, our perceptions can sometimes be different from person to person, from gender to gender, from, based on our experience, and having that broad, diverse workforce is important. I am a firm believer that, policies protect people, from discrimination, but, actually having leaders, diverse leaders, female leaders, it somehow, makes a cultural change. I don't think policy changes culture. Sometimes, unfortunately, it does take, one person to be the first. And sometimes, that's challenging in different, settings. But, once you have become the first, it seems to somewhat normalize. And I think that, other people can see themselves in you, and it makes them believe that they can accomplish something, or makes them think about it for the first time. Because unfortunately, we sometimes have to see ourselves in someone else who's doing a role before we can consider, we'll even think to consider that for ourselves. And so I think that's part of what changes the culture. And, I've always recognized that, getting the job was not the most important thing. Doing a good job once you get it is the most important thing that changes the culture.
Yeah, I love that answer. That's great. I kept thinking about, you can't be what you can't see. I feel like we've been hearing that a lot. It's absolutely true. And, you've certainly been trailblazing the way for women in leadership in medicine yourself. So, thank you for all you've done to help advance that.
Thank you.
So my next question kind of follows up well. As a trailblazing leader and example for women, certainly in Oklahoma, but also in all of medicine, what advice would you share with other women in the osteopathic field who are interested in leadership?
Yeah. Well, the first thing that, I would say is, for me, when I have decided to take on a leadership role, I've always tried to be very thoughtful about, why I wanted to take on that leadership role. But because when you find yourself in leadership is tough. And if you aren't real clear with yourself about why you want to do that, it can be a disappointing, venture at times. The other piece of advice I would say is, don't wait until you think you're ready, because, I'm not sure that anyone ever believes that they're ready, or that you can ever be fully prepared. When there's an opportunity for you to take on a role, take that on and learn from it. And, that's the way we don't set ourselves on the sidelines. Because, there have been opportunities for me and I've said yes to them, and that leads to another opportunity. And those are always opportunities to grow as a leader, to grow as a person, to expand your knowledge base. And so don't wait until you feel like you're and dream big. I tell students that all the time. I mean, don't limit yourself for what you can accomplish. The most important thing in being successful is putting yourself out there and saying yes.
Yeah, thank you. I appreciate that advice a lot. That really echoes what we've heard from other women in medicine we've been talking to, especially the part about not limiting yourself and the importance of doing that. So I think that's worth repeating here. So thank you for that good advice.
Yeah.
And my next question, I was kind of interested to hear about this conversation that you had in your past with a professor who inspired you to go to medical school. And then you went on to practice medicine as a pediatrician in your Oklahoma hometown. And then you later left your pediatric practice to pursue education because you felt you can make a greater difference for more people as a professor. And I was curious if your professor's encouragement back then and their example did also help inspire you to then go on and become a professor yourself.
I was very fortunate that I had a professor who just chose to, I really don't know why. It wasn't that we were, that I knew him well. I was in a large class, but he asked me to stay after class one day and asked me if I was going to medical school, and then encouraged me to go home and talk to my family doctor, who was a DO, and to visit a medical school and then decide if medicine was right for me. I think he really pulled me aside because I had the highest grade in his class. And, he didn't know, I wasn't considering medicine as a career. I don't know how he figured that out, but he did. And that's a little bit where I feel like having someone tell you can is very empowering, because I had never had anyone tell me I couldn't be a doctor. But and my parents growing up, they aren't college graduates. So I really went to school because I was on an athletic scholarship. And so I didn't know what direction I wanted to go. And, my scope of what I thought I could do was really based on, my limited experience of, what jobs were out there. And so now we always went to our family doctor, and he'd been my family doctor for, years. But that had never occurred to me that it was something I could do. And and my parents were always, very, very supportive, and would tell me, you can do anything you want to do as long as you're willing to work hard. But it goes back to that, you don't know what anything is. I mean, that you don't know what that is until you see it. And sometimes you don't know what that is until, someone encourages you to consider it. And that moment for me was very empowering and had a huge impact on me. And it has had a huge impact on my career, and, how in some ways, programs that I've created at the medical school, or, how I conduct myself, with students and others around, knowing how much that played a difference in my life. And so I would say yes. I mean, in some respects, his conversation with me definitely changed my view on, the impact you can have with your students and the importance of that.
Yeah, I can't tell you how much I love that. I just love hearing stories about people who've gone on to accomplish great things, whether it's in leadership or maybe in something in the arts or writing, and they can often pinpoint one professor or one teacher who said, oh, I really think you would be great at this, or oh, did you ever consider this? And it's amazing how much that can influence someone's life. So, okay, so my next question, one of your milestone achievements, and you've touched on this a little bit already, includes establishing the National Center for Wellness and Recovery, which supports addiction treatment and research to address the opioid crisis. Osteopathic training seems particularly well suited in providing non-pharmacological alternatives to pain management. How did your background in osteopathic medicine inspire your leadership in this area? And what more can osteopathic medical schools do to help combat opioid misuse and addiction?
Mm-hmm. Yeah, I think it's a really important, issue. And I think my osteopathic training made me a little more, aware and sensitive to the issue. What was really kind of a turning point for me was I had a medical student's father come visit me, and he had lost a son to opioid addiction. And, that was back probably around 2013. And I had never met him before, and he came in and he said, I think that, medicine is missing the point, and medical schools aren't teaching this right. And, I think my initial reaction, is to get a little defensive. But he started sharing his story with me, and, the challenges that he had with his son. And it started with an athletic injury, and, a very tragic story. And for me, as as an educator, as an osteopathic physician, understanding that there are other options. And I think, as a pediatrician and a mother, listening to that made me do a lot of soul searching in that moment to say, flip that around if I'm sitting in his seat. And he told me, that they went to their doctor and said, this is a problem, something's wrong. And then when, he started experiencing, really difficult times during addiction, no one really knew how to help him with his son. And to me, that's tragic. One, we need to prevent. We need to do what we can with, treat, osteopathic manipulative therapy and preventing pain. We need to take part in, when we can, in the development of non-opioid treatment options, whether that's, medication again or OMT. But, we also have to teach about addiction. And I'll be honest, in that moment when he was talking to me about it, I was listening to that, and, there's a stigma about addiction, and there's a stigma with addicts. And, I didn't fully understand. And I had that. And I had to struggle with that a little bit. And as I dug into the science and understood more about opioids and understanding more about addiction and how it changes your brain, it really changed my viewpoint. And so I do think, as osteopathic physicians and as osteopathic medical schools, we can lead the way in this, from research. And of course, now, there's the HEAL initiative. And when this all, 2013, it wasn't as talked about, and people didn't understand it as much. And so we started very early in that. And as I said, it started out, we just put some of our own resources in it to say, we need to do this. I had people calling, my family members, because they would hear me out in the community talking about it. And they would call my family members and say, can you get a hold of your sister? My dad is addicted to these pain medications, and, he has a job. He's a deacon in a church. He's embarrassed. We don't know what to do. Or, they're a veteran and they're withdrawing and they don't know what to do. There was no resources. And so what started out is, bringing in addiction specialists to start teaching in the curriculum and relooking at the way we were, focusing on that. And then, how a little bit more on pain and those kind of things really led to the development of research and services, clinical care. And we now have a fellowship, pain medicine fellowship. So yes, that I think it's very much found. Osteopathic medicine it can be a leader, or osteopathic, educators can be a leader in this. And of course, now there's the HEAL initiative, and there's lots of ways to get funding, and states are very, everyone understands, what a crisis we have and how many people we're losing unnecessarily. So it is an opportunity.
Yeah, definitely agree. And yeah, I think the osteopathic philosophy, it just does seem like a good opportunity, like you said, to lead the way. And it's a hugely important issue, especially in a lot of the rural areas where our students go on to practice. So
it is very much.
So my final question for you, Dr. Shrum, you've worked with Cherokee Nation Principal Chief Bill John Baker and his administration to establish the nation's first tribally affiliated medical school, and you're passionate about expanding access to primary care in rural areas. When you think of the future physicians who will care for Oklahoma's patients, what should that future look like, and how does this vision guide your leadership?
I think the most transformational partnerships happen when there's a common solution to a vision. Their vision was to improve the health of the Cherokee people, and they were investing in health facilities, and ours is, to improve the health of rural and underserved Oklahoma through training physicians. And those two things, we had worked with them very closely in the past. So we had a relationship But it's, that partnership is very mutually beneficial. And it really did, I think we have to have, a medical school class that mirrors, our population. And so, we've really focused a lot on making sure that our Native American students feel comfortable, that we're being culturally aware for all of our students. And that makes a big difference. So, today, you look across the United States, 0.4% of medical students represent Native Americans. At the Cherokee Nation campus, 20% of our students are Native American, and 50% are female. So I'm really proud of those demographics in that class. And so my vision for what does that workforce need to look like, I'm very pleased with that as a representation of the state of Oklahoma and what our population looks like. Obviously, we can always work on becoming more diverse, but it's a great environment as we are looking at, how do we put more physicians in rural areas and underserved areas and improve access to healthcare. When we start in day one, in a rural location, and they can go through all 4 years in a rural area and then have the option to, do their residency training in rural locations, or to do their, residency training within a tribal healthcare system. That's the opportunity to retain residents and physicians in rural areas. So, it really is, a culmination of us being able to fulfill our mission and having a common purpose with the Cherokee Nation. But I think the state of Oklahoma and the surrounding states benefit from that collaboration.
Yeah, I love that answer too. And just showing like the importance of unifying your whys, to go back to your earlier point, and then working together. Well, Dr. Shrum, this has been really inspiring and enjoyable to speak with you. I really thank you so much for taking the time to talk with us about this important topic. And thank you once again for everything you've done for women in medicine and just for the osteopathic profession as a whole. AACOM really truly appreciates your help in helping us celebrate women in medicine, not just this September, but always. So thank you again. And yeah, we very much appreciate it.
Well, thank you for having me.